Dr. Robert Shapiro with Shapiro Chiropractic and Nutrition here in Stockton, California. And today I wanted to ask you a very important question. How many of you or people that you know suffer with hip pain? The CDC, the Center for Disease Control, estimates that at least 7% of individuals suffer with hip pain in the United States of America. That comes out to 1 in 15 people. It's a pretty high number. It's high enough to know that I felt compelled to answer this question for you. Today, I'm going to go over 3 points to that question. Number 1, I'm going to show you the common sources of hip pain and dysfunction. Number 2, I'm going to show you the common signs of hip pain. And number 3, I'm going to tell you what to do with some very easy steps and tools that you can use in the comfort of your own home. Let's discuss the first point. Number 1, what are the sources of hip pain? The most common sources are the muscles in the hip joint area and in the pelvis. Specifically, the psoas, which is also known as the hip flexor. That muscle can be found by finding the bone in the front of your hip or pelvis, sliding just inwards of it approximately an inch, and then raising your leg off the ground. And you will find that the tendon of that muscle pops out into your fingertips. Oftentimes, it's very exquisitely tender. And many times that muscle will radiate pain down into the front of the thigh or even into the knee. The other sources of hip pain are the gluteus medius muscle, which is to the side and slightly to the back of the gluteal area. That muscle allows you to stay balanced when you raise off your foot. So when you're walking, for instance, that muscle keeps you literally from falling over. Unfortunately, it takes a lot of abuse and it generates pain. The third most common source of pain in the hip is the piriformis muscle, which basically comes off the tailbone and wraps across and over the sciatic nerve and attaches to the hip joint, to the femur, which is the thigh bone. And that muscle externally rotates the hip joint and the thigh. Another source of hip pain are the adductor muscles, which are the muscles on the inside of the hip. And finally, some other sources are directly in the joint itself and in ligaments that you cannot see from the outside. Again, today I'm talking the most common sources of hip pain. And interestingly, these common sources of hip pain lead to tightness of the hip and especially of the hamstring. So incidentally, if you do the things you need to in order to address this pain, many times you'll find yourself gaining flexibility. And that leads into my second point, which is what are the signs and symptoms of hip problems? The most common signs and symptoms of hip problems, and obviously, are pain in the hip, especially with weight bearing. Could also be when you're arising from a sitting position coming up. And the reason for that is commonly hip problems interfere with our ability to squat. One way to know whether or not you have hip problems is look at the way you squat. Use a mirror or have somebody observe it. And what should happen when you squat is that your hips should come straight out and they should drop to the ground. And you should have no pain and no immobility with that particular motion. Oftentimes what we will see is that people will go to squat, and instead of sticking the hips out and dropping straight down, they will lean their chest and shoulders forward and then squat from there. And the reason why they're doing that is they're taking the stress off their hips. They're placing it on their lumbar spine. I'm sure by now you can see that this is many times what leads to low back pain, and it really will. I can guarantee it. I've seen it many times in my practice. So it's very important to address those hip problems, that hip immobility or dysfunction. Another sign of hip problems is inflexibility in the hamstrings. And so the easiest way to gauge that is the simple reach to touch your toes. So coming down, attempting to touch your toes. Now you can see I have some stiffness, mainly because I exercised a couple of days ago and I have some soreness in my hamstrings. But oftentimes what you will see with people with hip problems is they won't be able to even reach down that far. Oftentimes they will come down and they will bend their knees in order to drop further. And so that's not what you want. You want to keep your knees straight and reach down as far as you can go. You'll also notice that they round their back a lot because they lack the mobility here in order to get that distance to their toes. So those are probably the most common signs of hip dysfunction. One more could be the inability to rotate the leg and knee outwards. Or if you do it on one side and the opposite side doesn't have balanced motion, that's a telltale sign of hip dysfunction. So now that I've kind of shown you some of the ways you can gauge hip mobility, let's talk about the simple ways that you can address it. And I'm going to do that with these easy tools today. Everybody should have these items in their tool chest. Not necessarily this. It's a little bit pricier. You can use just a regular stick, a wooden stick, a PVC pipe. This is just a fancy tool. You see it in physical therapy clinics and chiropractic clinics, sports medicine. This is inexpensive. This is a foam roller. And so I'm going to show you how to use this in a moment. And this is a lacrosse ball. So it's like a racquetball, but it has rubber throughout it. And it has some give to it, but it's pretty firm. And it's designed for using it for focal pressure points. And I'm going to show you that. So let's talk about how to address the muscles I just referred to. Gluteus medius, piriformis, hip flexor. So the foam roller can be used for all of these. We can take the foam roller and sit on it, direct pressure down underneath the gluteal area. That will target our piriformis because the piriformis wraps underneath when we sit. So we can kind of sandwich it between the bone in our pelvis and the foam roller and get a nice pressure point. And just kind of work on it and even lean over a little bit onto it and create direct pressure. And oftentimes you'll find a trigger point, you'll feel pain, and many times it'll radiate out or down your leg. So you can just work on that for about 15 to 30 seconds and then move on. For gluteus medius, we have to come down a little bit and move towards the top of our pelvis and towards the outside. Obviously, for demonstration purposes, I'm doing this on this bench, but you would want to do this on the floor. It's more stable. It allows you to get better mobility. Anyway, that's our gluteus medius, and I'll also show you how to do this with the lacrosse ball. For the iliopsoas, we go forward. Again, we find that point, the point in our pelvis, come just off of it to the inside. And that's where we're going to apply that pressure. And again, we would be on the floor with this, but I'm going to kind of be leaning over to that side with that leg straight out. This leg helps me pivot and move. And once I find trigger points in there, or tightness or discomfort, I'm going to apply steady pressure for about 15 to 30 seconds until it releases, and then move around in it till you find all those points in there. Moving over to the lacrosse ball, if we need more focal work, we can take that ball, sit it down in a chair or on something that's solid, a good surface we can sit on. It has to have some firmness to it. It can't have too much give like a couch. It's got to be able to push back. So now I can really target that piriformis, and oftentimes when people have knots in their piriformis or hamstring, they're going to feel pain radiate down their leg. If they have sciatica, oftentimes they'll feel that pain of their sciatica. 15 to 30 seconds, you will feel it release. For glute med, now I can get more focalized work done, you know, and again, the point for this, right kind of in this corner right here. So here's the hip joint, there's the corner before we get to the tailbone. So kind of break it down into quadrants. So here's the front line, here's the back line. This is your point you kind of want to target, you pretty much want to target with that. Ball in there, leaning into it, you know, nice steady pressure, 15 to 30 seconds, releases it, does a great job. You can kind of use this for your hip flexor. I wouldn't suggest it. The foam roller is a better surface, you have better control, digs deeper, you know, doesn't put as much pressure on the bones. So I would use the foam roller instead. For hamstrings, we could use foam roller or we can use this. So again, this stick would be like a rod, like a wooden rod or a PVC pipe. So from here, we can get in and work on our hamstrings and roll them, find trigger points, apply downward pressure, release them. Same process, 15 to 30 seconds. We can do this with the foam roller. Now here, we get it underneath our hamstring, we set up and we apply pressure downwards as well as we get the upward pressure from the foam roller. 15 to 30 seconds. Oftentimes you'll have trigger points or knots in multiple parts of the hamstring. So you're usually going to want to go to the bottom of the hamstring, the middle, and the top of it. With the hamstring, you definitely want to be in a chair or on something like this. It's hard to do it on the floor, especially if you have some flexibility issues. And lastly, let's talk about the adductors, which are the inside muscles. On a chair, you can straddle the roll and you can basically, just like we did hamstring, we're going to apply downward pressure on the inside of our thigh. Find those trigger points. You can move out further to where they attach to the knee. You can move to the middle. You can move up closer towards the hip. Again, pressure, find your point, apply pressure, 15 to 30 seconds, and you'll feel it release. And then after you've done this, and obviously you want to do it on both sides, come back and check those points of mobility and see that you get more motion, you get a better squat, you feel better when you do these, and you should have far less pain and possibly even no pain at all. So I hope that helped you today, and I'm glad you came to look at this video. We really appreciate you stopping by, and we'll see you again in a future video.